As a parent, few things are scarier than seeing your child struggle to breathe. Respiratory distress, simply put, means a child is having difficulty breathing. This can be a sign of a mild illness or a more serious medical condition. It's crucial to recognize the signs early and act swiftly. Prompt action can make all the difference in ensuring your child receives the necessary care. Remember, children are not just small adults. Their bodies work differently, and their respiratory systems are still developing. This makes them more susceptible to respiratory problems. While some respiratory illnesses are mild, others can be life-threatening. Knowledge and quick thinking are your best allies in protecting your child's health. Knowing the signs of respiratory distress is the first step in protecting your child. One of the most obvious signs is rapid breathing. You might notice your child's chest moving up and down very quickly. Another telltale sign is noisy breathing. This could sound like wheezing, grunting, or whistling. Look for changes in your child's skin color. A bluish tinge around the lips, fingers, or toes is a red flag. This indicates a lack of oxygen and requires immediate medical attention. Retractions are another alarming sign. This is when the skin between the ribs or around the neck sinks in with each breath. If your child is struggling to speak or cry due to breathing difficulties, seek help immediately. If you suspect your child is in respiratory distress, don't panic. Stay calm and take these steps. First, try to keep your child calm and comfortable. Anxiety can worsen breathing difficulties. If your child is old enough, have them sit upright. If an object is blocking their airway, such as a piece of food, perform age-appropriate first aid to dislodge it. If your child has a known allergy and you suspect an allergic reaction, administer an antihistamine immediately, if available. Keep a close eye on their symptoms. If their breathing doesn't improve or worsens, seek medical attention immediately. In situations involving respiratory distress, it's always better to err on the side of caution. Call your child's doctor or emergency services immediately if your child exhibits any of the following: blue or dusky skin color, especially around the lips, fingers, or toes; severe difficulty breathing, such as gasping for air or struggling to breathe in and out; noisy breathing that doesn't improve, such as loud wheezing, grunting, or whistling sounds; retractions, where the skin sucks in between the ribs or around the neck with each breath; a high fever that doesn't improve with medication; lethargy or extreme drowsiness, especially if your child is difficult to wake up. Section 5. At the hospital, common treatments and procedures. If your child is experiencing severe respiratory distress, they'll likely be admitted to the hospital for observation and treatment. The medical team will work quickly to assess the situation, stabilize your child's breathing, and determine the underlying cause of the distress. They'll use a variety of tools and techniques to achieve this. One of the first things they'll do is check your child's vital signs, including their heart rate, respiratory rate, and oxygen saturation levels. They'll listen to your child's lungs with a stethoscope to assess their breathing patterns and identify any abnormal sounds. In some cases, they may order blood tests, X-rays, or other imaging scans to get a clearer picture of your child's condition. One of the most common treatments for respiratory distress is oxygen therapy. This involves delivering supplemental oxygen to your child's lungs, helping them breathe easier and maintain healthy oxygen levels in their blood. Oxygen can be delivered through a variety of methods, depending on your child's age and the severity of their condition. For mild cases, a simple nasal cannula, a soft tube with 2 prongs that fit into the nostrils, may be sufficient. For more severe cases, a mask that covers the nose and mouth or a hood placed over the head may be necessary. In extreme situations, a ventilator, a machine that breathes for the patient, may be required. In addition to oxygen therapy, doctors may administer medications to help relieve your child's respiratory distress. If the distress is caused by an allergic reaction, antihistamines and steroids can help reduce inflammation and open up the airways. For infections like croup or pneumonia, antibiotics may be prescribed to fight off the bacteria causing the illness. Bronchodilators, medications that relax and open up the airways, are commonly used to treat asthma and other conditions that cause wheezing and shortness of breath. These medications can be delivered through an inhaler, a nebulizer, a machine that turns liquid medication into a fine mist, or intravenously. In severe cases of respiratory distress, your child may need additional breathing support. This might involve non-invasive ventilation, where a machine helps your child breathe without the need for a breathing tube. One common method is continuous positive airway pressure, CPAP, which delivers a constant stream of pressurized air through a mask, preventing the airways from collapsing. In the most critical cases, your child may require intubation and mechanical ventilation. This involves inserting a tube into the trachea, windpipe, and connecting it to a ventilator, which breathes for the patient. While this may sound frightening, it's a life-saving intervention that allows the lungs to rest and heal. Witnessing your child in respiratory distress is undoubtedly terrifying, but remember that you are their advocate and source of comfort. Stay calm, be present, and ask questions. Understand the treatments being provided, and don't hesitate to seek clarification from the medical team. Your child's well-being is their top priority, and they'll guide you every step of the way. With prompt recognition, decisive action, and quality medical care, most children recover fully from episodes of respiratory distress. Arm yourself with knowledge, trust your instincts, and remember that you're not alone in this journey.